Imagine this. You're sick, really sick. You need medicine. The kind of illness that keeps you up at night, makes you feel like you're fighting a losing battle. You visit the doctor, hoping for a solution, a cure, or at least some relief. But there's a catch. The medicine costs more than you make in a year. You stare at the price tag in disbelief, your heart sinking as you realize that the life-saving treatment you need is financially out of reach. This isn't a dystopian nightmare. It's not a scene from a science fiction movie. This is happening right now, in our world, in our cities, and in our neighborhoods. It's the reality for millions, held hostage by a system where profit trumps health. Families are forced to make impossible choices between paying for medication or putting food on the table. This is the story of Big Pharma, where life-saving drugs meet cutthroat business, and the results are often deadly. Pharmaceutical companies prioritize their bottom line over human lives, creating a crisis that affects us all. We're going to journey into the heart of the pharmaceutical industry, exposing the tactics used to influence politicians and inflate prices. From backroom deals to aggressive lobbying, the lengths these companies go to protect their profits are staggering. Get ready for a wild ride through lobbying loopholes, marketing madness, and shocking stories of greed that would make even the greediest Wall Street banker blush. We'll uncover how these companies manipulate the system to keep prices high and competition low. Buckle up, it's about to get uncomfortable. We're diving deep into a world where the stakes are life and death, and the only thing that matters is the bottom line. Stay with us as we unravel the dark side of Big Pharma. Who are these powerful entities controlling the world's medicine cabinet? Let's meet the players. First up, we have the pharmaceutical giants, multinational corporations with more money than some small countries. These companies are household names, often seen in the news for their groundbreaking drugs and treatments. They dominate the market with their vast resources and global reach. These behemoths invest billions in research and development, but also billions more in marketing and lobbying. Their R&D departments are filled with top scientists working on the next big cure, but their marketing teams are just as busy, ensuring their products are the ones doctors prescribe and patients request. Next, we have the lobbyists, smooth-talking masters of persuasion, working tirelessly to influence lawmakers. These individuals are often former politicians or industry insiders who know the system inside and out. They use their connections and expertise to shape policies in favor of their employers. Their mission? Ensure regulations favor Big Pharma, even if it means higher drug costs for everyday people. They argue that high prices are necessary to fund innovation, but critics say it's more about profit margins. And let's not forget the politicians, some of whom are more interested in lining their pockets with campaign contributions than looking out for their constituents' health. These elected officials often rely on donations from pharmaceutical companies to fund their campaigns, creating a conflict of interest that can influence their decisions on healthcare policy. The result? A complex web of influence and power that can leave patients struggling to afford the medications they need. While some argue that this system drives innovation and brings life-saving drugs to market, others believe it prioritizes profits over people's health. In the end, the players in the pharma game have a profound impact on our lives, from the medications we take to the prices we pay. Understanding who they are and how they operate is crucial for anyone navigating the world of healthcare. Imagine a world where whispering the right words into a politician's ear can shape healthcare policy. That's the reality of lobbying, Big Pharma's favorite pastime. These companies spend billions every year to ensure laws benefit their bottom line, not necessarily your health. It's a legal form of bribery, dressed up in fancy suits and backroom deals. This influence peddling results in policies that keep drug prices high and generic competition at bay. It's a rigged game, and guess who always loses? You guessed it, the patients. Ever heard the phrase revolving door in politics? It's not about fancy office entrances. It refers to the cozy relationship between Big Pharma and government agencies. Imagine this. A politician helps pass legislation favorable to a pharma company, then conveniently retires to take a high-paying job at that same company. This revolving door spins so fast, it's hard to tell where government ends and Big Pharma begins. This blurring of lines leads to lax regulations, conflicts of interest, and a system that prioritizes profits over patients' well-being. Section 5. Patent games and monopoly money. Big Pharma has a knack for turning life-saving drugs into cash cows. How? By playing a game called patent protection. They file for patents on minor tweaks to existing drugs, extending their monopoly and delaying the entry of cheaper generics. This strategy allows them to charge exorbitant prices for years, even for life-saving medications. Imagine needing a drug to survive, but knowing it's artificially overpriced because of legal loopholes. This isn't just a game, it's a matter of life and death. Section 6. The price of life itself. In the world of Big Pharma, the price of a drug often has little to do with its research cost. Instead, it's about maximizing profits, even if it means pricing patients out of existence. We're talking about life-saving medications like insulin, EpiPens, and cancer drugs, priced so high they're inaccessible to many who desperately need them. This isn't just about greed, it's about corporate social responsibility. When the pursuit of profit overshadows the fundamental right to healthcare, something is deeply, morally wrong. Section 7. Marketing miracles and manufacturing needs. Big Pharma's marketing budgets are bigger than some countries' GDPs. They spend billions on advertising, pushing their drugs on consumers and doctors alike. They create a need where none exists, convincing us we're sicker than we think and need their pills for happiness. This relentless marketing creates a culture of over-medication, driving up demand, and you guessed it, profits. It's a vicious cycle, fueled by fear, misinformation, and a whole lot of money. Section 8. Opioids. A case study in greed. The opioid crisis is a harrowing example of Big Pharma's ruthlessness. These companies aggressively marketed highly addictive painkillers, downplaying the risks and pushing for their widespread use. The result? Millions addicted, countless lives lost, and communities devastated, all for profit. This wasn't just a failure of regulation. It was a calculated strategy of greed with devastating consequences. Section 9. Regulatory capture. The Fox Guarding the Henhouse. Who's responsible for regulating Big Pharma? Government agencies, you might think. But what happens when these agencies become too cozy with the industries they're supposed to regulate? It's called regulatory capture, and it's a real problem. Imagine a watchdog that's been tamed and trained to fetch. That's what happens when industry insiders fill regulatory positions, weakening oversight and allowing Big Pharma to operate with impunity. Section 10. The global reach of pharma's power. Big Pharma's influence extends far beyond the borders of wealthy nations. They wield immense power in developing countries, where regulations are often weaker and access to essential medicines is limited. This creates a two-tiered system, where the wealthy can afford treatment while the poor are left to suffer. This global disparity in healthcare access is a moral stain on humanity, and Big Pharma's relentless pursuit of profit plays a significant role. Section 11. A Glimmer of Hope. It's easy to feel overwhelmed by the sheer power and influence of Big Pharma. But there's hope. People are waking up to the injustices of the system. Grassroots movements are demanding affordable healthcare and holding politicians accountable. Change is never easy, especially when facing powerful industries. But as public awareness grows and the demand for reform intensifies, there's reason to believe a fairer, more equitable healthcare system is possible. Section 12. Fighting Back, a call to action. We can't stay silent. The time has come for us to rise and make our voices heard. The stakes are too high and the consequences of inaction are too dire. We must demand transparency in drug pricing, stricter regulations on lobbying, and a commitment to ethical practices. The opaque nature of drug pricing has left too many in the dark, struggling to afford the medications they need. We need to put an end to the revolving door between government and Big Pharma. This unholy alliance has compromised our health and well-being for far too long. It's time for our leaders to prioritize people over profits. We need to support access to affordable medications for everyone, regardless of their socioeconomic status. No one should have to choose between paying for their prescriptions and putting food on the table. It's a fundamental right that should be accessible to all, not just those who can afford it. The disparity in access to healthcare is a glaring injustice that we must address. This isn't just about healthcare, it's about social justice. It's about ensuring that every individual, regardless of their background, has the opportunity to live a healthy life. It's about reclaiming our health from the clutches of corporate greed. The influence of big pharmaceutical companies has distorted our healthcare system, prioritizing profits over patients. It's about ensuring everyone has the right to affordable, life-saving medications. These medications are not luxuries, they are necessities that can mean the difference between life and death. It's a fight we can't afford to lose. Together we can make a difference. Together we can create a future where healthcare is a right, not a privilege. Join us in this call to action.